With September Pain Awareness Month, the U.S. Pain Foundation is all about increasing public awareness of chronic pain and the issues people with pain face. The West Virginia Pain Institute spoke with our Newswatch reporter, Jillian Risberg, about pain management alternatives in a state plagued by opioid addiction.
We've been through the opiate crisis from 1999 up until prescribed opioids until about 2015-16, where we started to see a decline with the CDC guidelines that were released. There are certain limitations and restrictions that should be considered when prescribing opiate medications for pain patients.
That did help stem the overuse of opioid prescriptions. Dr. Brian Yee says at the West Virginia Pain Institute, they evaluate the patient, see what their anatomic problems are, and what's causing their pain.
And try to come up with a comprehensive multimodal plan to try to help address the pain issues, whether it's physical therapy, any kind of rehab options, cognitive or psychological therapies that can help, acupuncture, even just exercise, and including injection therapies that we do, as well as small surgeries.
As southern West Virginia continues to be devastated by the opioid epidemic, Dr. Brian Yee's alternative approaches to treating his chronic pain patients has never been more important. In 2024-2025, the Mountain State saw a decrease in opioid-related overdose deaths, leading the nation in its rate of reduction. But health experts advise continued vigilance.
We still have 700, 800, 900 people dying of opioid-related deaths in our state per year, so that's still a very high number. It has transitioned, though, from misuse or inappropriate use of prescription medications to now the synthetic opiates.
CDC's 2022 update guidelines of long-term opioid therapy shows no benefit compared to taking Tylenol and acetaminophen. Dr. Yee says in his generation of training, they had a pendulum swing from opioid therapy being very standard to becoming non-standard.
And that's reassuring to let people know that, hey, not everybody needs to have a certain type of pain medication prescription to try to help address their pain complaints. We're relying more on other options, including interventions in smaller surgical and minimally invasive procedures to help alleviate pain.
It feels great, Dr. Yee says, because he has never been an opioid proponent.
My reputation of the past 15 years in this community is that I'll try to do the best to take care of you, but I'm not going to be a pill pushing kind of guy for you.
The doctor says in America we want easy fixes.
And people's perception is a pill, especially even for pain, is an easy fix. And that's not the case, especially when it comes to opiates, and that the risks of overdose or other complications are much higher. So it's having just open, honest conversations with your patients and with your providers and with your community.
At the West Virginia Pain Institute, Jillian Risberg reporting for Newswatch.